Let us start with giving a small brief about India and for the students, for your graduate students and the new comers who are just passed out from 12th standards. It may be a new subject altogether, being in the healthcare department, being the healthcare management. But it's a beautiful department of working, and India has been ranked amongst a very top healthcare destinations all over the world. So let me start with giving a small brief about Indian healthcare system. India has emerged as one of the biggest healthcare destination uh, in whole of Asia, as well as in any other continent. There are patients who travel to India from different parts of the world. In 2015, there was an estimation that the industry of the healthcare industry in India is worth $3 billion, and which was expected to be $9 billion by 2020. And this is what we see today. The industry has rapidly grown in last 5 years in India. The reason behind it was the support from the government and the involvement of the private sector healthcare institutions in whole of the India. New Delhi is a big center for medical treatment. Mumbai is a big center for medical treatment. Chennai, if anybody don't know, is called the healthcare capital of India. So to get medical. So Chennai has its own flavor of delivering healthcare for a long time. There are reasons behind uh, uh, the travel of foreigners as well as Indian patients. See, what we do, we segregate the travel of hospital management. Let's come to the business development part under the heading of healthcare management. There's a small part called sales, and sales we divide primarily into two parts. That is the domestic sales and an international sales, and that is how the hospital works. And this is going to be one of the most demanding career opportunity in another 5 years or 10 years in India, because what we have seen is the number of patients, the number of hospitals who are coming up in India. Every 6 months, India see a new beautiful developed hospital with the state of art technology and with high-end doctors. Indian doctors are considered worldwide as on data what we have seen. 40% of the doctors in US, they belong to India. They are from Indian origin. 30% of the doctors in UK, they are of Indian origin. So you see, in Western countries, the the composition of doctors, is from the Indian origin. So the doctors have been considered worldwide for their development, for their skills in treating the patients, and that is how we divide the segment of sales under the healthcare management into two. The first is the domestic sales, and that is where most of the graduates who are just passed out, you know, they will be more interested in learning about more about the hospital, as well as the graduates will be more interested about knowing more about the sales and the career prospects for job opportunity. So let me start with the domestic sales. India, Chennai is a favorite destination for Indians who travel for medical treatment. I remember one of my relative back in 15 years back, 20 years back, he traveled from my native North India to Chennai for a medical treatment. And same goes where a lot of patients from all over India, they travel to Chennai for medical treatment. So there is a huge prospect in Chennai for development of healthcare. There's a huge demand of manpower. There are a lot of hospitals who are coming up in Chennai, and there are a lot of opportunities is going to be there in for next 5 years in Chennai. So what we do basically in sales, in domestic sales, I'll discuss the other part, that is the international sales, in my next session in few minutes. So let me come cover the Indian aspect. So it will be very interesting for the graduates of your college right now who are passing out. So there is a huge demand of manpower, where the hospitals require specialists in business development to reach out to different societies of India to represent the hospital and to understand the concept of what treatment, what healthcare requirement is there in these remote states, and then make a system, then make an ecosystem where patients who are in need of treatment gets connected to a correct doctor, they get connected to a correct hospital, and then they make their own travel to the city and get treatment. Now what we see is from Punjab, now Tamil Nadu is one of the best infrastructure in health, and Tamil Nadu government has been involved in many pioneer activities, in for last 10 15 years, has been amazing. The government has an amazing job in making Chennai as a healthcare destination, both for Indian and foreigners. So now what we see today from the state of Jammu Kashmir, we see a huge crowd coming to Chennai for medical treatment. We see from Punjab, we see from West Bengal, especially if you see the northeastern part from of India, we see a lot of patients who are in need of transplant, who are in need of orthopedic department, who are in the need of different medical treatment. They prefer traveling to a place which is known for healthcare, which is known for quality healthcare, who has a good infrastructure, and as well the best of the best doctors in all over India. So the hospitals now have a proper team. They've developed a proper team who takes care of the complete business development of the hospital. They take care of complete strategies and business planning of the hospital, medical treatment, and they work with the doctors. They work alongside with the doctors. They understand the product, and then they take things forward in the regions. We segregate regions, and then they do their work. So what with the vision of having a beautiful ecosystem where a patient sitting anywhere in India understand that X treatment is available in this hospital in Chennai, and say Chennai or any other, say Bangalore or Mumbai. I'm not specifically talking about Chennai, but of course Chennai is the healthcare capital of India. I'm more inclined towards Chennai and the quality of healthcare what Chennai has been delivering for last several years. So and they prefer their destination. A patient in Nagpur can may prefer traveling to Mumbai, or somebody from Mumbai, uh, uh, you know, can plan to go to Delhi, and somebody from Delhi. We have seen a lot of patients from Delhi coming traveling to Chennai, so and so on. That's what how the hospital works. And with the number of hospitals coming up every year in Chennai, there's a huge prospect of the manpower which is going to be required in another 5 years. We have seen a very state of art hospital which were launched in Chennai in 2019 by the Honorable Vice President of India in Chennai. And the infrastructure, the concept, the overall infrastructure of the hospital is it can be compared to a hospital in US. I mean, it's amazing to say India has now been with the state of art technology and the doctors, can is equal to any good hospital in Europe and US. So my suggestion to the uh, graduates who are recently graduates from college is to have the opportunity. Of course, it's a time of Corona, so everybody is on home ridden, and things are not moving around. But in another, we are expecting in another couple of months things to be settling down, and uh, the things will come back to a normal in another some time. Until then, what we need to do is to have career opportunities ready. Visit the hospitals. Try to visit different hospitals or clinics and other places, and understand what is the requirement of uh, career opportunities. Not only hospital, the Indian pharmaceutical company, 30% of medicines sold in the world are exported from India. India is a big country who export the medicines abroad. Recently, we have sent medicines in Corona to more than 15 countries. We sent it to US, we sent it to Israel, to Kuwait, to UAE in huge quantities to fight COVID-19. So India is one of the best, destination for exporting medicines. So not only I'm talking about the hospital sector here, but I'm talking about the healthcare as a whole, where pharmaceutical also is a part of the discussion. And pharmaceutical is one of the high rise in India now with certain new policies coming out from the government of India. It is easy for Indian pharmaceutical to export the medicines abroad. And with the huge demand of this new, China controversy, this India, there is a great opportunity for Indian pharmaceutical companies to to grab this opportunity. And India is also 30%, 40% of the global demand. India supplies the medicine. So pharmaceutical also is a big option. We have so much big companies like Lupin, like Mankind, and other big, Sun Pharma is one of the biggest pharmaceutical company in the world. So we have so many pharmaceutical companies have been working in India for so long. And uh, this is one thing which, if anybody is interested, I'm sure they will be considering, going to uh, pharmaceutical companies and having a career opportunities in future. Now, let me just give you a small brief about why India. Now I'll talk about India as a healthcare destination for people who are not in India, and this is what is one of my favorite specialty, where I have been working for last several years, spending some time on making more strategies of making India as a whole, presenting it to different patients or different corporates abroad. And it's a country to country relationship, so we used to go and meet the government officials and take help of the Indian government in approving so many things. So now what I'm going to discuss is another very interesting, very charming work which have been associated with me for last several years, is the medical value travel. It is the business development of India and Indian hospitals abroad. So in a nutshell, to give a brief, what we do is India, keeping in one side that Indian hospitals and doctors are one of the best in the world. We also need business, to to sustain in the market, to have the proper output. We need the hospitals, they need business. So for a business of a hospital is the number of patients what a hospital gets. So it may sound strange, but that is how hospital works. A private hospital, I'm not talking about public sector, but the other 60% of the private sector, the branches of healthcare, which comprises of the most bigger hospitals in all over all the metro cities. Delhi, we have so many good hospitals. We have Vedanta, we have Fortis Hospital in Delhi, Max Hospital in Delhi. Come to Mumbai, you have branches of Global Hospital in Mumbai. You have Breach Candy Hospital. You have Leelavati. You have big names in, you have Saifi Hospital. You go to Kolkata, we have different hospitals. And then, of course, when you come to Chennai, you have a list of good hospitals, state-of-art hospitals. And then the list is keep on going. The new hospitals keeps on coming every year. Right. So to meet the demand, Chennai has almost 15,000 beds. Chennai has a capacity of 15,000 beds. So to meet this demand of the number of beds and the patients, we need to have some proper strategies for the patients who are seeking healthcare treatment in their own country, who are out of India, but they are willing to get proper treatment, which may be not available in their country, which can be any other reason. So what a reason what we present is, first thing is the India is a premier destination. Now what is premier destination? India has a good number of hospitals. India has 39 JCI accredited hospitals. So now hospitals also, when they start the segregation of hospitals, are into two categories. One is NABH, which is the Accreditation Board of India, National Board of India, who give license to the hospitals to run, as well as there's a committee based out of US, which is called JCI, Joint Commission International. What JCI do? JCI find out the healthcare destination in whole of the world, in whole of everywhere in the world, and give them certificates. So having a JCI certificate is like having a shining star to your badge, and once you are JCI, that means you are a standard hospital. So there's no doubt about that. So there's a team visits your hospital who have a certain protocols to follow, very strict protocols of hygiene, very strict protocol of the medical protocols, the system the hospital used to run, and then once they get convinced, they issue JCI accreditation, which needs to be renewed every alternate year from the JCI. So India is one country where we have 39 JCI hospital, which is one of the highest in the world. And out of JCI, we have so many hospitals in Delhi. We have so many JCI hospitals in Delhi. We have Medanta, we have Fortis Hospital in Delhi, Fortis Memorial Research Institute FMRI, which is a JCI hospital. And JCI primarily, what do they do? It gives you a shining star for a patient sitting abroad, especially that if the hospital is JCI accredited, then they don't need any further questioning and they travel down. So India is a premier destination. India is considered to be rich in culture. India is considered to be rich in very old history of India. So this is one reason why why people sitting abroad may also prefer coming to India, because they will also get to know more about the Indian culture. After their treatment is over, they may have chances of roaming around certain cities, going to see Taj Mahal, and etc. So number two is the most important reason is the facilities. Now, India, as I told you, all the metro hospitals in India and metro cities in India has different hospital and have their own USPs. We have in Mumbai is also one of the biggest destination of healthcare in India, where I remember for a long time the patients from the Gulf countries, from the Arabic countries, from Dubai, from whole of UAE, from Oman, they used to come long ago by ship. If you see the history of healthcare in India, 30 years back, you know, there were a lot of patients from Muscat. They were taking ship and they were traveling to Mumbai on a ship, because there was not so much culture of airlines that time. They were coming to Mumbai for a long time and they were getting treatment in different hospitals, and then they go back by ship. So this is what India has a history of treating foreigners. And India now in last 10 years or last 15 years has done amazing work with the medical engineering, with the latest technologies right now in India. Any technology in any new technology in healthcare is it's now available in India, be it cancer, be it for cancer, be it for organ transplant, be it for any other bigger or more high-end technology. Recently, last month we have done one of the high-end. I'll be happy to share the link with you. And each one of the patient who came from Egypt, with our involvement in the with the government of Egypt, who came to Chennai, and that surgery was done for the first time in the country, and that was amazing. The government of India has appreciated the work of the doctors. That such a amazing new concept the doctors have brought in treating the heart failure patient. So I'll be happy to share the link with you after the session to understand how we are doing it, the healthcare right now in the country. JCI accreditation, we are the sixth in the world in terms of JCI accreditation. India is the 17th country in the world to establish a proton therapy for treating cancer. Now, there is the highest, uh, the latest technology for treating cancer, oncology of any kind, be it stage 1 up to stage 3, is the proton therapy. And we have a hospital in Chennai, recently launched in the heart of the city, has been considered one of the best in treating cancer patients. That is a proton therapy center. So India is one country which have been focusing more on treating cancer and has become the 17th country to launch the proton therapy session. Other than this, there is a concept called minimally invasive, where there is a very minimum cut to your body, and doctors do your surgery and you will come out of the operation theater without any scar on your chest or on your body, and nobody will ever know that you have got surgery. So minimally invasive surgery right now in the Indian doctors have developed a technology where they are not treating brain or spine or heart or other high end surgeries without having a scar on your body. There will be a small hole as the size of a pen in your body, and with the needle they will operate the surgery, they will do the surgery, and once the surgery is over, that you will be coming out of the theater. 2 days you are walking, 2 days you are doing your work, and nobody is going to know that there's a scar on your body. So that is something, one of the high end technology what Indian doctors have come up, and that is very interested. All the patients who are going for these surgeries, primarily other than open, they go for minimally invasive surgeries, right? The hospital infrastructure in India right now is considered second best. What I say for us is the best in the South, or in India, Asia Pacific is one of the best healthcare infrastructure. 50% of the global needs, what as I told you earlier, this is the correct statistics in front of me, that 50% of the global supplies of pharmaceuticals are supplied from India. So to US, to different parts of to Europe, to different countries, India supplies 50% of the global medical uh, for the medicine. So this what this indicates is a huge demand of the pharmaceutical industry to grow, and we require manpower to take things forward. So a lot of graduates now who are joining, we have seen recently, they are joining these industries, they are joining the hospitals and infrastructure and the pharmaceutical industry, and growing their career. We know a lot of uh, students who recently started their own work. I mean, they were working for hospitals or pharmaceutical companies for a long time, and now they started their own work. They have become entrepreneur. They have been associated with the industry for a long time. Uh, Other than this, of course, what we see, one more point is India is a birthplace for yoga and Ayurvedic medicine. Although Ayurveda is very famous in India, a lot of foreigners also for preliminary disease. They sometimes we get queries from abroad that they want to come to India and enjoy the Ayurveda treatment. So Ayurveda is also, a lot of patients come to Kerala. Kerala is a place which is famous for Ayurveda treatment, and we see almost 20% of crowd coming to India. They also prefer coming for Ayurveda treatment. So Ayurveda, for long time has been a big USP for India, where patient would like to try Ayurveda with the proper traditional Indian medicine for the medicine, and they get healed, and they come healed and healthy. Now, another very important factor of why patients or of a person or somebody who is sick prefer coming to India or prefer coming to Chennai or Mumbai as a whole is the cost. So if you compare the cost of open heart surgery in US, in any of the hospital in US, in any of the hospital in UK, or any hospital in Singapore, it is almost 10 times or 20 times higher than India. In India, open heart surgery may cost you 3 lakh rupees, whereas if you see open heart surgery in America, in any of the good American hospital, will cost you at least 20-25 lakh rupees. So this gives an opportunity for foreigners to come and stay in India, enjoy the treatment, and that with money what they save, they can roam around. They can roam around here and there, and they enjoy their treatment. They visit to India. one more important reason which I forgot, and let me just mention, is in Europe. What happened? Europe has a queuing system of healthcare in Europe. For most of the European states, is free. In more developed countries, and you everything is insured, everything is free, and you need to approach the government, have giving your name, and then government will issue you a waiting list time for a small surgery. So say a dental surgery or any surgery or any spine surgery which you want to do it in Europe. So that doesn't mean you can just walk into the hospital and do the surgery. So there will be a waiting period of 3 months or 4 months or 5 months in any of the surgery. The reason behind it is there's a huge queue of patients, and insurance take time for approvals. So all these elective surgeries, they also have an opportunity to travel down to India, where you can just walk into the hospital, meet your doctor, and if the doctor gives you advice on the surgery, surgery can be performed anytime when doctor suggests. So there is no waiting time in India, where we say the uh, there's a waiting time and the patients have to wait for a patient who is suffering for heart failure, cannot wait for so long. So this is something what has been attracting the international patient for a long time here. So that now with this all these factors what I have discussed with you is to bring to your notice that there is a huge demand of manpower in another 5 years or 10 years of Indian healthcare industry, with estimating this industry to be growing at the rate of 20% per year. And hopefully, every year we see a couple of new hospitals, state-of-art hospitals in all the metro cities. So in Delhi or Mumbai or Bangalore or Chennai, on an average, you see at least two hospitals, two state-of-art hospital, big private hospitals being launched every year. And all these hospitals require manpower. All these hospitals require people to support the hospital, people to work, and with it comes a great opportunity for the students to plan their career in healthcare management, in the hospital management, not only in sales, but as a graduate or as a professional in healthcare. uh, you can easily get a job in finance department of a hospital, in operations. Operations is a very interesting part where you need to deal with day to day challenges of the hospital. Every day is a new challenge for you in a hospital. You see different patients coming into your place. Somebody's VIP, somebody's not able to pay the bills, somebody, there are a lot of different challenges what you see. And then you see a big minister coming to your hospital. So in the operations department, you can try a career and join the operation department, where you can deal day-to-day activities of the hospital. There's a big scope of BCom students with the domain in finance, especially with finance background, to to join the hospitals and join the finance team of the hospital, join the other financial team of the hospital, and so on. So hospitals require so many of staff every year, and it gives a great opportunity for everybody to try their career in healthcare management. So with this background of Indian healthcare, what I have, and there are a lot to talk about in details. So this is what I have discussed with you is only the bullet points, only the rough idea of Indian healthcare. If you get opportunity again in future, will be more interested in going to deep with more deeper knowledge about every aspect, every sector of healthcare, be it in the domestic sales, be it on international sales. Now, let me just give you a brief of people who come from abroad. So, just for knowledge, just because we are having a discussion on foreign business development, see, the Indian hospitals are always very much interested in associating with the hospitals or the doctors abroad. It gives the flying wings to the hospital when we are associated with different hospitals abroad, or with different doctors or ministries. I remember whenever we travel along with the doctors, mostly we travel to Gulf countries or any African nation, and different countries. We always meet somebody from the government, either the minister of health or We see a bureaucrat who is taking care of the healthcare program of the country. And the primary, this also give me two, this also we can divide in two. There are two reasons why people will travel. One is the treatment is not available in India, in their country, and it's available in India. So a nation like any nation in Africa, for example, let's say a North African country has no technology of treating a heart failure patient or a lung failure patient, or say a high end brain surgery. They don't have machineries, they don't have equipments, they don't have the infrastructure to handle, they don't have ICU or nurses. So this is one reason why a patient who has insurance, or who is capable of paying or getting a support from the government, and then what they do, they travel because it is not available in their country. The other reason for travel is, as I told you, is the waiting list. So what happens in a country like Europe, in European countries, a patient who is scheduled for a spine surgery will be asked to come to the hospital after 3 months for the surgery, but the patient unfortunately cannot wait. So this is the other reason why people travel. And for India, if you talk about top countries for Indian industry, it has been Bangladesh, our neighboring country, Bangladesh, which has seen a good number of patients. Last year, 1 billion, I think 1 million patients from 1 to 126 countries. So last year in 2019, India has seen 1 million foreigners from 126 countries who traveled down to India for medical treatment. This is the statistics from the government website. And out of this 1 million crowd, 45% of the international crowd came to Chennai. So you can understand how potential is healthcare in Chennai, which we sometimes we don't know, and sometimes we don't focus, because most of the students, when we graduate, we always wanted to have a job in bank, we wanted to go for a financial sector. But this is something which is very interesting, and which patient with a lot of people coming here, the students need to understand the growth in this industry. So they have to think about it, reach out to you for more counseling, reach out to me if they require, and understand that this huge potential, and this is expected to grow to 1.5 million in 2003. Unfortunately, this coronavirus has come in from March onwards, so there is no flight being operated from March till now, no international flight. Otherwise, 2020 is also, first 2 3 months have been as per the plan for the hospitals. So with this 1 million patients from abroad coming to India, with at least 40 45% coming to Chennai, you know, gives a huge opportunity for manpower. And we see crowd from Bangladesh, from Afghanistan, from Sri Lanka. We see patient coming from UAE. UAE is a Dubai is one of the favorite place for everybody, which is advanced in everything. Of course, they are also advanced in medical treatment. All those patients, the government, they send their cases to India for medical treatment. From Africa, we see a lot of patients coming from Russia. We see a lot of patients coming from Ukraine or Azerbaijan, the uh, far west of Asian countries, the CIS countries, what we say, the breakdown of Soviet Union. So they see a huge potential in India. Last year, 300,000 Russians came to India for medical treatment last year. So Russia also is one of the major contributor to Indian healthcare. Ukraine and other Russian-speaking countries, as well as Arabic countries as a whole, from Oman, from Yemen, from different countries. So all these countries has huge potential of Indian hospitals to go there to start their work, to make a business development activities, to start a that is we call ecosystem, where we make a system that anybody who is in requirement of a correct medical treatment comes out, reaches out to their doctor, reaches out to the hospital ethically, properly, being guided by the doctor, and then they get the medical treatment more efficiently. Right now, we know there are so right now at this current moment when we are talking, we have a huge number of foreigners who are being in Chennai for medical treatment, and they have been waiting for long for different treatment. Also, one major contributor, one of the most important thing to know, just for your information, that India has a policy, and the Indian government has a policy of organ transplantation, organ donation. The organ donation is a organ transplantation process where one organ of the human being is being replaced by another organ, and that is how organ transplantation is of two kinds. One is called live organ donation, that is called live transplant, where somebody of your relative can donate a kidney or a liver can be donated while you are awake. You can give one of your kidney or liver to your relative or to your family. Other type of transplant is a cadaver transplant. Cadaver means for all those organs who cannot be donated while the patient is alive. So unfortunately, we have trauma cases, we have accident cases, and you must have heard about somebody donating their heart, somebody donating their kidney or lungs or pancreas or a small intestine to somebody. I'm sure you must have heard in any time before. That is called cadaver transplant. India is a country which allows foreigners also. This is very good to know, and something to cheer, that Indian government, as per the law of the Indian government, as per the NOTO, any foreigner who requires a cadaver transplantation like heart, lung, or pancreas, or uh, you know other cadaveric organ, can travel down to India, get registered with the government, and then uh, and wait for the organ. But the policy says the Indian patients will be given preference. So until there is any patient for transplant, they will be giving they will be given chance for a transplant. So India also, and that is what we work primarily. What it is my our company work is the development of organ transplantation. So we reach out to different government abroad. We reach out to the ministries, we reach out to the Minister of Health of different countries, and then we treat those patients on transplantation. There are a lot of patients who have been waiting here for transplant. So transplantation also has given a big name, big for the Indian healthcare system to grow, and and it is a country to country relationship. So we've seen a lot of VIPs. I remember some time back the uh, uh, a brother of a health minister of one of the Arabic countries. His brother, he was diagnosed with a heart failure, and he sent his brother to one of our senior doctor, who's one of the senior most doctor in the country for treating heart transplant. So imagine a brother of a health minister of an Arabian country taking a heart surgery in India. Sounds very good, and sounds very proud that we are capable of handling such important cases in our country. So this gives a lot of opportunities for the young graduates who are being passed out from your college to plan their career in healthcare management. Reach out to us, reach out to you, or reach out to me. Again, if you need deeper information on what all things we can do, uh, uh, in which sector of hospital they should plan their career, what are the opportunities, what are the other important questions of joining the hospital or a pharmaceutical company, or if there is any chance of starting their own work with experience. So I'll be happy to join again and clear the doubts. But I see there is a huge opportunity in another 10 years of Indian healthcare, where hospitals are being coming up, where clinics are being coming up every very very frequently, and there is a huge requirement of manpower in another 5 to 10 years. And once you get a professional, once you get trained for several years in the healthcare industry, I'm sure you'll be having a bright future in this industry. Another one important point is anybody who has worked in Indian hospitals, right? Sometime after working for 5 to 8 years in Indian hospital, they may get easily a job in a foreign country, because the foreign countries like Dubai or Oman or other Arabic countries, primarily the Arab countries, they require a skilled manpower, and somebody who has got trained in India for several years in a hospital. They also want a professional staff. They will give you a job easily in future once you get trained. So I'm sure I'm able to give you a small brief about the Indian healthcare. Also, I've covered so many of bullet points, so you may be confused in a lot of things. But I'm sure, if time permits, again, we'll be able to connect again and clear doubt one by one for all your questions.
The first question is from Durga, as you already referred. Can we do MBA healthcare management or hospital management after MSc biology or biotechnology or biochemistry field?
Hi, Durga. Thank you for the question, and very important question what you have asked. I'm sure this is on behalf of many other students. You are asking this question. Now, if you see, uh, 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 now I personally know many of the doctors who are going for MBA. So that will answer your question in one line. Now I've seen a doctor. Now I'll tell you the reason behind it. Uh, we have seen MBBS or MS or MD doctors, especially the MBBS doctors. These doctors, they finish their medicine, they join hospital as a doctor. But what they understand is there has to be somebody sitting on chair to run the hospital. Now, running hospital is different from doing a surgery. So, what hospital now? If you see all the big hospitals, I mean in Chennai, if you see hospitals like Apollo or Global or Fortis or different big group of the hospitals, the head of operations, the head of the operations, or the person who is the director of the hospital or the senior person of the hospital is the doctor, is a non-practicing doctor. Why? Because he has a knowledge of medicine, where he understand, he can have a long discussion on a clinical discussion with the doctor, as well as he has done MBA from a institute which gives a healthcare management to understand how to run a hospital. So this gives you actually doing a MBA in healthcare. After a MSc or a biotechnology or biochemistry, as you said, it gives you a very good combination of having a background of medicine or healthcare plus the operations. So this is something what I will always recommend. BSc students or MSc students to go for MBA. So a dual degree, I'm sure you have a good career in in having a operations department of the hospital. I'm sure hospitals will be happy to recruit anybody who has a knowledge of healthcare as a student, as well as managing the hospital. So this gives you a big yes to your question, that it is a very good combination of doing MBA for career opportunities in the hospital.
Thank you, sir. The next question is from Arish Venkat. Sir, what you said is correct, but the latest advance in medicine is used in exporting and curing patient in abroad. When will it be used to the economic people? Still, many hospitals in India and Tamil Nadu are suffering in inadequate medicines and ventilators. Please explain us, sir.
Now, see, the government of Tamil Nadu has a scheme, has a healthcare scheme. Now, Ayushman Bharat scheme has been started by our Honorable Prime Minister of India. So that is a nationwide scheme. Other than nationwide scheme, you have to understand health has always been a concern for the states. As per the Constitution of India, health has been given as a priority, as a subject to be run by the state government. That means Tamil Nadu government is fully capable, fully responsible for having their own healthcare system. UP has their own system, Bihar has their own system, Punjab has their own system. What I mean to say is, as per the Constitution of India, the states are responsible for the healthcare. Now, when it comes to state, every state has a policy where the government fund the below poverty line or economically weaker section of patients. So I remember, this is answer to your question. I remember one of my when I was working in a corporate hospital in Chennai in 2016, and we see to kids from the weaker section, from the economically weaker background, they have got heart transplantation. Now heart transplantation is something which will cost you 30 lakh rupees, and 30 lakh rupees something is a huge money for any middle class, or even for a higher upper middle class. So now you understand, economical weaker background person, a kid of 11 year, got heart transplantation free of cost. That was funded by the government of Tamil Nadu. So I'm very happy to announce that the government of Tamil Nadu has so many of schemes running for economical vehicle section. Like what they need to do is they just need to go to the hospital, uh, uh, present them the situation, and the hospital will always get in touch with the government, take prior approvals, and their treatment will be done. So that is answer to your question. The government of Tamil Nadu has a scheme of treating economic or weaker background in any of your private hospitals. So of course, yes, these technology and everything is accessible in Tamil Nadu for everybody.
Yes, sir. Thank you. And another question from our staff, Dr. Rajalakshmi, Department of Commerce, Avichi College. Sir, do you give any intern training for BCom students?
Of course, we do. We select every year summer training or winter training or a part-time training. Even this year, we have selected a few students. We have selected a few students in Delhi, in Mumbai, and in Chennai, who are doing training in different sectors. So, of course, we are providing healthcare, training, as well as the internship program for 1 month or 2 months, depending on what is it required. And then it will once you are working on this project, you gain a good knowledge of healthcare while working. I remember one of my good friend, one of my very junior, 10-year junior to me, and he always wanted to be in the same healthcare field, so he started very properly. He started as an intern in a big hospital with my help. He reached out to a good hospital in Delhi. He did summer training in the hospital. He did winter training in the hospital from the college, and then he joined the same hospital, as an employee. So you understand what I mean. The opportunities are so much that sometimes as an intern, when you reach out to the hospital, and you can reach out to any hospital for training. I'm sure every hospital has a good, robust training program for students. And you can, and once you perform well, once your bosses, their bosses are happy, I'm sure there is a career opportunity as well. So yes, of course, we do provide a training program, and you can reach out to us for any opportunity.
Okay, sir. And Professor Yaya has asked, what is the job opportunities and salary for learning a foreign language like Arabic, French, Germany, or any other as translator in hospital industry?
Good. Thank you, Dr. Yaya, Professor Yaya, for asking this question. I actually forgot to mention this. I need to go back to Delhi during the reference of Delhi. Jamia Millia Islamia. Everybody knows Jamia Millia Islamia is one of the central universities of India. In Delhi, now what I have seen is when patients are coming from these Arabic countries, especially a typical Arabic country like Iraq, or somewhere Yemen or Syria, they have very less knowledge of English, so they are dependent on a person who speaks both languages, that is either Hindi or either Tamil or a local language as well as Arabic. So also there is a big opportunity for students to learn Arabic, to learn any foreign language. Now, of course, Arabic remains number one in Chennai because the number of Arabs coming to Chennai is huge. But as well as other than Arab, what I suggest is now another 5 year or 10 year, the Russian language is something which they should also consider as a part of their. It's very easy language to learn, and there are a lot of Russian institutes in Chennai as well as the Russian Cultural Center in near Alwarpet. So you can reach out to the Russian Cultural Center or Russian consulate who is near Marina Beach. and consider having one more language added to your profile. I'm sure Arabic and Russian and these two primary languages will, because if you say Arabic, you have considered whole of the Arab region. So that doesn't specifically of one country. And same goes to Russia. Either Azerbaijan, Uzbekistan, you name the Soviet Union countries. There is of 10, 12 countries who have the local language, but they also speak Russian. So by these two languages, actually, if you get a command on Russian and Arabic, you will have access to at least 30 countries at one time. So this gives a good opportunity for a person who has a medical background or a non-medical background with the hospital profile, who speaks these languages. Now again, I'll give you an example of a new hospital which was launched some time back. When they were launched, they didn't had a official translator in the hospital because they were too new to have a Arabic translator in the hospital. But the marketing manager whom they recruited, who worked in Saudi Arabia for several years, so he was speaking Arabic. So he was then later shifted to the other department. You understand how much it is required, and it's very good question asked by Professor Yaya, that there's a huge demand of languages also. So I'm sure, and that is not very difficult to get. It will take another 1 month or 2 months or something for you to learn a language if you dedicate proper time, and within couple of months you'll be ready to have your own discussion with the foreigners. So Arabic and Russian, which I prefer, which I recommend for students to consider for their future.
Yes, sir. Thank you, sir. Another question. Sir, what is the opportunities available in the current situation for the students, and how are college students, that is Avichi students, get help to equip them to be placed in healthcare management?
Good question again. When at the time of Corona, things are a little slow. But now, even if you see, when banks are not working, when other institutions are not working, when railways are stopped, when everything come to a halt, when the real estate industry came to a halt, you name the industry and it came to a halt. There were only two industries who were working throughout. That was the pharmaceutical industry making medicine, and the hospital industry serving the patients, right? So that means even in 2008 recession, if I tell you, hospital was the only industry where you know there was a very less impact of the recession in 2008 recession. So what I say is, uh, there's a good opportunity for the students of Avichi College, to reach out to their staff and understand the prospects of opportunities in working the hospital. It's very less impactable in financial crisis, as well as the growth what we have seen in last several years, say in 2010 onwards. In last one decade, the Indian healthcare has drastically grown, and irrespective of any turmoil in the Arabic countries or in African nations, and the industry has proven to one of the best industry to grow. So of course there will be impact on something, as we have seen now. For last 3 years, 3 months, there is no travel of for Indian patients or foreigners to India. But I'm sure all this travel and everything will start again once things comes to a halt. So prospects are there, and in this crisis, even in coronavirus crisis, uh, uh, don't lose hope. There is lot things to come, lot of positive things to come, and I'm sure within another 3 or 4 months things will come to a normal in India, and again the recruitments and the staff management and everything will start.
Thank you, sir. Another question from Prakash sir of Avichi College from Department of Visual Communication. How strength is the health system in Tamil Nadu? Since you traveled across countries, how do you find ourselves?
Sorry, I did get the question.
Yes, sir. I'll repeat it again. How strength is the health system in Tamil Nadu? Since you traveled across countries, How do you find ourselves?
See, okay, let me talk about, as I told you earlier, uh, we present India as a whole in terms of healthcare, because in Delhi, in Mumbai, and other places, there is a good number of hospitals and travel. But especially when you come back to Tamil Nadu, now Tamil Nadu, as I said earlier in my first 5 minutes of discussion, Tamil Nadu attracts 50% of the foreigners in India. Anybody who travel to India, 45 to 50, last this is for last 5 6 years, 45 to 50% of foreigners in India are coming to Chennai. So that is the testimony of the great work done by the government of Tamil Nadu. You know, and that is excellent to know that the government is doing excellent work. They have been working alongside with the private sector and the public sector. The government hospital of Tamil Nadu is excellent. The private sector is excellent, and Tamil Nadu government has done an amazing job in last several years to bring the healthcare up. So Tamil Nadu ranks amongst the top service provider in the world, in the country for healthcare.
Okay, sir. Thank you, sir. The last question. Studying medical in Russia or Philippines, is that worthy? Do you recommend, sir?
I do recommend. We have a lot of doctors who have got trained uh, who has got trained in Russia and other places, and they came back to India and started practicing. So of course, you can study medicine anywhere and come back to India for your career.